for most of my career, I've really spent time teaching sort of upper level undergraduate students and master's level students. And so coming here to the School of Health Professions was a new thing for me and a bit of a challenge in a couple of ways. One of the ways was just trying to learn about what I needed to teach physician assistant students, and I'll talk a little bit about that. And then the other thing is learning how to use the Anatomage Table. I had some experience using some of the virtual cadavers, but not this particular platform. And so we got our first students in January of 2021. So I'm just about halfway through my second year of teaching in this program. And so part of what I'll show you is just how I've learned to use the tables and some of the things that I do with them. And maybe those are things that you might be able to do as well. So St. Bonaventure is a relatively small private Franciscan university. And so this is the building that we're in, Francis Hall. You can see we're out in the middle of the trees, really. And this is a building that was originally built back in the 1950s as a friary for the Franciscan priests or Franciscan friars who were training here. And then in 2017, they started a new School of Health Professions. And that school is in a completely renovated building that we're in, and includes a couple of master's programs, one in physician assistant studies, the other one in occupational therapy. And then a number of undergraduate programs, including health science, students, public health. There's also should have put under the master's, also a master's of public health program that's going to be starting soon. So geographically, this is where we're located in sort of southwestern New York State. The areas here in green are showing underserved rural areas. And so one of the major reasons for starting this School of Health Professions at the university is because there's a real need for healthcare in this area. It's a lot of underserved areas. And so hopefully some of our students that will go through the program will stay in this area. So this is our first class of students plus the faculty. And so one of the things I'll just tell you is who our students are. And then some of the things we need to think about what they need to learn. So all of our students coming in have at least a bachelor's degree. Some of them also already have master's degrees. They have a whole variety and range of different kind of clinical experiences. Some of them are already, like certified X-ray technicians or certified dietitians, variety of different professional experiences. And so at the very least, they come in with a full year of human anatomy and physiology. For some of them coming straight from undergrad, maybe they just had that a couple of years ago. Others have been out of the classroom for some time. And so they may need to catch up a little bit. And so those are the students that we're teaching. And then what they're learning essentially is a fairly comprehensive curriculum. So what I'm showing you here is just an overview of our modular format. So we teach in sync with one another in the different classes. So I'm teaching basic sciences and teaching physiology and anatomy. My colleagues are teaching them pharmacology and clinical medicine and patient assessment. And so, for example, we start with the respiratory or pulmonary system. And as we're going through, they're learning about that from all the different facets. So as you can see, when we go through a full year, they are really learning a lot of comprehensive material. And one of the things I should just mention, because some people don't know what all the PA profession does or encompasses, PAs basically practice medicine. And so they do work under the supervision of an attending physician, but other than that, they can do many of the same things that a physician can do. They can have their own patients, they can prescribe medications, they can be involved in surgeries, a whole variety of things. So they really need to know, have a good foundation in physiology and anatomy. And so we teach year round. So right now we're in the summer semester. We actually just finished the renal module, and we're going to be going into the reproductive system. But that's just kind of an overview of what I have kind of as a charge to teach these students. This is the virtual anatomy lab that we have for our students. And so you can see there's a couple of sides. There's one side here, and then it's separated by a partition, and there's another side. If you look back here, you can see that for each table, we do have a high resolution flat screen that we can plug in with an HDMI table or cable. We're going to have, when we're completely full, about 40 students in a class. And so what I've been doing is breaking them into small groups. So a little bit bigger than this. We usually work in groups of 5 to 6 students. And so one of the things that's really great about these tables is they're very interactive. Students can work quite independently. And the other thing that I've noticed is students teach one another. And so you could think of this, you know, if you think of it sort of formally, this is something that could be called peer-led team learning. They're working as a team to learn the material, and they can come up with their own insights. And one of the things that I'll show you is how I use quizzes to get them to interact with the tables. And oftentimes, as I'm walking around fielding questions and that kind of thing, I can see that the students are helping out one another, you know, reminding them of where a structure is, or correcting them, or giving them suggestions. And so that works really well. So this is a figure, it's a little game of hidden figures. Here it's Find the Rabbits. Probably everybody's played these games at some point in time. I remember going to my dentist as a kid and looking through the Highlights magazine for the Seek and Find. Anatomy in some ways is like this, because essentially what we're trying to do is understand pieces or parts of a whole system within the context of the whole. And sometimes it's quite difficult to focus in on a particular structure when all the other complexities are there. It's sort of like focusing in on a single tree in a forest. This is an image that's a screenshot from the Anatomage table. And so similar to the Seek and Find, you can see that there's a lot of complexity here. By the way, just if you're not familiar with the tables, this is a screenshot taken directly from the table. The tables, though, are much better than this because they're interactive. And so one of the things that you can do with the tables that you can't see from these still images is that you can actually rotate them in any kind of, 360 degrees. You can add structures. You can selectively put everything or limit what you have on the tables. And then you can also pan up on them, look at things in very high magnified resolution. The other thing you can see is that you can selectively color different structures. So the red and the blue there for the systemic arteries and veins, I've chosen those colors. So here's another example. One of the things I'm going to focus in on are some specific elements within the abdominal cardiovascular system and how those interact with the GI system. But here, if you just look unhighlighted at all of the vasculature within the abdominal cavity, again, it's kind of intimidating and it's overwhelming to work with. And so one of the things I have to think about as students are going into the lab, even though I circulate around and field questions and help them out just like you would in a traditional anatomy lab, I'm trying to give them work that they can do on their own and sort of explore on their own. And so that's really part of my objective, and I'll show you how I've been doing that. So strategically, one of the things I want to show you that I've been doing and still playing around with and learning with is to start with simplified structures and then sequentially adding different layers of complexity. And so I'm going to show you a couple of examples of that. On the table, sort of getting around on the table, what that's going to look like is setting up a series of presets. So the presets, if you've used the table, you know these are preset sort of selections of anatomy that you can save on the table and then go back to whenever you want to. You can also use those presets and load them into a quiz for the student. So that's one of the things that I'll show you, that strategically I'll put together a series of presets, and then from those presets I build a quiz so the students can go directly from sort of exploring and investigating the structures on their own and then jump into a quiz where they can really test their knowledge and work with one another. So what I'm going to start with as an example is the hepatic portal system. And so one of the things that I discovered the last time that I was teaching the GI system was that students were having some confusion about the difference between the hepatic portal vein and hepatic veins. And so there's a complex relationship that's really important that they understand. So it's not just simply identifying structures and naming them, but they need to understand that the principles here that are involved. So what I've done here with this preset, so this is again just a screen capture of a preset that I built, is here you can see the hepatic portal vein, and then here are vessels that lead into that. And so we'll talk a little bit about that. So the first thing I have to do with students is, again, think about things conceptually or functionally. What is a portal vessel? So the hepatic portal system is one example, maybe the most dominant example of a portal system. So a portal system is basically a vessel that's connecting two capillary beds. And so this is different, of course, from what we think of traditionally as, within a systemic arterial and venous system to an organ, because you're not going back to the heart between the venous side and the arterial side. So it's directly connecting one capillary bed to another capillary bed without going back to the heart first. So the hepatic portal vein basically connects the intestinal capillaries with the capillary system within the liver sinusoids. And so again, this is kind of a direct route for delivering the blood from the GI system into the liver and forcing it through the liver before it goes back to the systemic circulation. So here again is the hepatic portal system. I've highlighted the hepatic portal vein there in blue so that you can see it. And then basically, if you think about the direction of blood flow, it's coalescing or bringing all the blood from the GI tract directly into the liver. And then one of the things I can do with the Anatomage tables very quickly is just I've added the liver. One of the things you'll notice is that it's semi-transparent. So you can see the location of the liver, the orientation of the hepatic portal vein, and really spreading through the liver, perfusing that. But you can see the vessels inside the liver. Again, if this were on the table, you can spin it around three-dimensionally. You can pan up and see things very closely. And so this is one of the images that I might set up for the students and just let them explore that a little bit. The other thing just to mention too, if you haven't used the tables, is if you touch, the tables are basically sophisticated touch screens. If you touch any of these images, it will immediately come up and tell you what the structure is. So students are able to learn on their own and really explore and see how things are arranged. So the liver is really the place where the blood is going to. Where is it coming from? So here I've just added the small intestine. So here you can see the duodenum leading into the jejunum and the ileum. So it's coming from the small intestine. It's coming from the colon. So there you can see the large intestine starting with the cecum. It's also bringing blood or draining blood from the stomach and the pancreas, also the spleen, which is here. I haven't added that on. And so all of the blood coming from those organs is going into the liver. So the next thing that you really have to think about conceptually, and one of the things that I do with my students, is to get them to think about, well, why the liver? And so the liver is basically, the major metabolic organ of the body. And so the nutrient-laden blood that's coming directly from the GI tract is going directly to the liver so that it can decide, so to speak, what to do with all of the nutrients, what to do with the sugars like glucose, what to do with the amino acids, what to do with iron, those kind of things. The other thing is that there's potentially bacteria coming from the gut into the cardiovascular system. And so if you actually could culture some of the portal blood coming from the gut, it would actually grow bacteria on a plate. And so one of the things that the liver is also doing is that there are fixed macrophages, the so-called Kupffer cells, that are getting rid of those bacteria. So if you think about, there's a lot of talk about the microbiome these days. That's basically gut bacteria coming from the colon. And again, some of that sort of leaks into the blood. So it's important that the blood goes through the liver. And so all of that blood's really forced through the liver. And so to understand that, before we just keep talking about the route of flow, the students have to understand something about the anatomical organization of the liver. So the liver is basically comprised of these individual lobules, which are sort of spherical units of liver tissue. And around the perimeter of those lobules, you have blood vessels. One of the major ones is the hepatic portal venule coming from the hepatic portal vein. There's also arterial blood coming from the systemic hepatic arteries. All of that blood basically goes through the capillary bed or the sinusoid system of the liver and into the central vein before going back into the systemic cardiovascular system. So actually, one of the things that I use on the tables, and I'll just mention here in addition to the sort of gross anatomy, is that well, first of all, the tables have histological slides that you can access. Here's a histological image, a drawing from a textbook. And so it's important to understand the histological organization of the liver. So again, here's the periphery of the lobule, and this is the direction that blood flows. So it's really being forced through all of those hepatocytes through the sinusoids. Another thing that I've been doing on the tables that I really think is quite powerful is using some of these scanning electron micrograph or SEM images. This is out of an atlas for SEM. And what this is showing is a vascular cast of the blood vessels coming through the hepatic portal vein. So here's a portal vein, and you can see how much it branches and how densely it branches into this capillary bed. Again, those are the capillaries that are, or sinusoids that are going through the liver. And so blood would course through in this way. It has to go through there to get back into the systemic circulation. Here's another image from the scanning electron micrograph atlas. And so again, you can imagine blood flowing or percolating through those sinusoids and into the central vein. Here's a vascular cast, lower magnification of the liver. And you can see here is a single lobule. So the whole liver is really comprised of, hundreds or more of these lobules. And here are the central veins where the blood will leave and then go back into the inferior vena cava. So it has to go through the liver and perfuse that tissue before going back to the systemic circulation. So here, if you can see in sort of blue, I've added the hepatic veins. So again, students are sometimes confused and perplexed by the difference between hepatic veins and the hepatic portal vein. So here's the hepatic portal. It's not highlighted, but here you can see that the hepatic veins go back into the inferior vena cava. So here is where the heart would be. This is the superior vena cava. And so you can illustrate and you can use different colors to highlight that. Here I've highlighted the hepatic veins in blue, and I can show the hepatic portal in white. And so then students can see that in this area, essentially what we're not seeing are the capillaries that interconnect the hepatic portal vein back to the hepatic veins. So there I've, illustrated some different things. I set these up as presets. If you've used the tables, you know that this little icon down here, the 1, 2, 3, is where you click to bring up the window for the presets. Here you can see 3 of the presets that I was just showing you, and you can do more than 3. So I might set up 8 or 10 presets and let the students go through them on their own. They can progress from simple to complex and work on understanding the basic level of anatomy before they go on. Then if you look down here, the checkbox, if you check that, it will select all of the presets, and then you can click export. It's not highlighted right now because I haven't clicked this, but then you can export that whole set of presets and save them either on the table, or you can save them to an external hard drive. And there you have them saved, and students can use them as they want to. I should also mention that students can take these presets and modify them, color them on their own, whatever they want to do. And then I just ask them to save it with a different number so that it doesn't overwrite my preset. So students can really do a lot with that. Then the other thing I'll tell you is that once you have that preset saved, if you go to this icon right here at the bottom left, this is the quiz icon. And when that comes up, you can see it says quiz mode. And then you can load, if you click this button, you just simply load the presets that I just saved. And then you can select the structures. You go into customize and you select which structures from those presets you want to have the students quizzed on. And then the quiz goes through and progressively asks them different questions. They can, there's some different modes. Pick me, they go all the way through the quiz before they find out how they did. There's another mode that most of our students use that's called flashcards. And so there they get immediate feedback as to whether they've selected the right structure or not. So that's a good way that they can jump into this and start learning on their own. So there you just do load and pull up your presets. Then if you save it as a quiz and give it a different name, then it saves that quiz. So it's pretty streamlined. So I'll give you a second example of the same kind of thing, again, focusing on the blood supply into the gut. And so what we'll look at here is the arterial supply to the stomach. And this is an image from the physiology textbook that basically just shows different regions of the stomach and the first part of the duodenum that are susceptible to peptic ulcers. And so one of the things that we talk about when you're thinking about clinical medicine is that if you have ulcerations, they could impact the arteries that are located in the areas around the stomach. And so here it's important for students to have an understanding of which arteries are in, for example, the lesser curvature and going down towards the duodenum versus in the greater curvature up towards the cardiac region of the stomach. So here I've started essentially just with the descending aorta. And here you can see the celiac trunk coming off that. I've limited everything else. So here's the splenic artery, the left gastric artery, and the common hepatic artery. And so students can learn those major branches and spend some time getting to know them. The next thing I'm going to show you is I'm going to turn it so that you can see from this position. This is another great thing that you can do with the tables is, again, you can look from any kind of a perspective you want to. So I'm going to look from a superior position looking down inferiorly. So here's the anterior, left, right, and posterior. And this is the same structure that I was just showing you. So here's the aorta, here's the celiac trunk coming off of it. And then here I've highlighted the left gastric and right gastric arteries, and you can see that they form this anastomosis or a loop between them. And so again, as students are learning this, it's less overwhelming if they learn the splenic artery, the left gastric, the common hepatic, and then they can see this pattern. It simplifies it so that it's not really overwhelming. Here's the same image, but I've added some vessels to this. So the left gastroomental and the right gastroomental. And so again, you can see the left and right gastric arteries here, but we've added something to that, added some complexity. Here I've added the stomach, and again, it's semi-transparent, but you can see the relationship between the gastric arteries and the gastroomental arteries and how they correspond to the inferior curvature and the greater curvature of the stomach. Again, this is the same perspective looking from a superior to an inferior position. And again, I'll just emphasize that as a preset, they can use this as a starting point, and then they can go in and change it or turn it or look, from a different perspective. They can add structures, like, for example, if they wanted to see where the vertebral column was in relation to this, they can do that. Here, I've just added most of the arteries of the abdominal cavity, and I've left the ones we were just looking at highlighted. So once you've got that in your mind as a search image, it's helpful to recognize that. But you can see, again, with increasing complexity, it's really challenging. Here I've gotten rid of the highlighting. So if they've practiced, they think they know where the left and right gastric arteries are and so forth, then they can start with this and go see how much they know. They can challenge themselves. Again, here's the preset key and the quiz mode key. And so if I open up the presets, Again, you can see that I've got a series of presets, the ones that I've just shown you. You can also order these, I might mention. So if you want number 3 to be in the position of number 1, you can click this button over here and just drag and drops and reorder them, whatever order that you want them in. Once you select the checkbox, again, I export these and I save them. Typically what I do is I save these on the desktop at the table in a folder where the students can find them whenever they want to. So our students are in the labs, not just during lab time, but they come in at night, they're here on the weekends, they can work quite independently on the tables. Then again, select the quiz mode key and it will open for the quiz. And then if you click load, again, what you'll do is find the presets that you just exported, load it into the quiz. Then you can go through the process of customizing it and deciding which ones of the structures that are on there that you want students to identify. Typically, when I'm putting together quizzes, the length might be a starting quiz just to get them introduced to an area, might be 10 questions, kind of get their feet wet. As they progress through, I sometimes have quizzes that are as many as 50 questions. And another thing that's been a lot of fun is that since we have 2 tables, is sometimes we'll have friendly competitions and we will see not just who gets the most answers right, but have them go through a challenge and see how quickly they can answer them. So students really enjoy doing that. So one of the things I've enjoyed with the tables is that they're a lot of fun in addition to really being amazing, being able to learn complex anatomy in high detail. So there again, load, and you can just bring in your presets. So the last thing that I will talk about is how I've used practicals. So for our students to do assessment, they are tested on this material. And so one of the things that I've done is learned how to use the tables to set up lab practicals, which is really, I think, a very effective way of testing their knowledge. So, you know, a traditional lab practical, like most of us has probably done, you spend hours and hours either sorting through different cadavers or different specimens, getting them laid out in position so that you can see specific structures and that kind of thing, and then physically putting pins in the structure that you want to identify. Well, there are virtual pins on the table, and you can see what I typically do is I lay them out so it goes 1, 2, 3, 4, 5 from left to right. This is just simply a preset. And so once I have my presets put together, I can just pull this up and students can go through and identify the structures. Again, the nice thing about this is that you can pan up, you can really get in close magnification, you can spin the cadaver, you can move it in any kind of a direction you want. And students then answer those questions. It takes a little bit of practice if you haven't done it, but you can learn pretty quickly how to get those pins in place. And the thing that's really cool is once they're in place, it really looks like they're virtually stuck through the structure. So if you look up here and you can see the jugular vein that I've highlighted in blue, if you look closely, you can see the pin is actually impaling that structure. And so students can tell very definitely what they're looking at. The other thing I'll just notice or point out is that I can decide to highlight structures if I want to. So for some of these vessels, I selectively highlight them with a color so that there's no confusion about what the structure is that's labeled. But if you want to make it more challenging, you can also leave them uncolored, and it's very much like a traditional practical where they have to identify the structures just from looking at them. Here's another example of that. One of the things that I've been playing around with is sort of having, again, different levels of complexity. So here I've got a lot of blood vessels and those kind of things that are on here that are not necessarily the focus of the particular pin or the practical, but they do a couple of things. One is that they serve as a frame of reference. So even like the skeletal structures, serve as a frame of reference for all these different vessels. But the other thing is sometimes just by having more complexity, it makes it more challenging. I know that students sometimes when I'm giving the practical and I'll pop up on a preset that has a lot of different structures, whether they're vessels or nerves or whatever, and then they, sometimes say, wow, that's really confusing, and it takes them a minute to get their bearings, but that's good. It's different levels of sort of challenge. So again, I've got presets 1 through 5. You can actually do more numbers than that, but just what I've done is I typically set up multiple presets, each one with about 5 or 6 questions on it. And then I can go through those and show the students what it is that I'm asking them about. The other thing that's really nice about having these virtual cadavers for lab practicals is that probably most of us, after spending several hours setting up an actual practical with cadavers or specimens and putting pins very, very carefully, getting them exactly where you want them, students inevitably want to poke and prod and move things and that kind of thing, which messes up the practical for everyone else. Here, what I do is after we've gone through the basics and run through and everybody's had a chance to see all of the structures, then they can come up individually and they can take a closer look. They can pan up on the structures and look at them. If you're doing that, just a couple of hints of things that I've learned is one is that you can change the language from English to something that's nonsensical so that if they happen to touch a structure, it doesn't tell everybody what it is. You can also lock down the screen so that students can move it and spin things and look at the magnification, but it doesn't identify or highlight the structures as they're going through and doing that. So they really can get their hands on it and there's not any danger that they're going to hurt anything or give it away. And finally, here's another example of, these are actually from lab practicals that I've given. So here you can see the hepatic portal vein highlighted in blue and some other vessels there as well. But that's what this would culminate with for each one of our modules, is that they finish with a lab practical, and I can assess how they've done. And I will say that our students do very well on these. I generally have averages on the lab practicals well within the 90s, which to me is really great performance. And certainly compared with other lab practicals that I've given in the past, not on the Anatomage tables, I think they're doing very well.